Thank you very much for joining. I'm Miriam Jashi, the CEO of the Global Sepsis Alliance. It's amazing to have so much interest from around the world. And in parallel to starting the webinar, we will be admitting new participants. And without much ado, I would like to hand over to Ali Hossein, the member of the Global Sepsis Alliance board and the strategic communication specialist and the lead of communications at the New Zealand Sepsis Trust. Ali, over to you.
Thank you very much, Mariam. I'm delighted to see you all here today. And on behalf of the Global Sepsis Alliance, I thank you very much for your interest. I'm also the moderator for today's event, and I just want to take a moment just to briefly explain how it's all going to work. We're set down for around 1 hour, and the purpose of the webinar is to raise awareness of sepsis as a leading yet preventable cause of death and disability, to share personal stories that bring a human face to the statistics, and to present the 5 facts, 5 actions framework for World Sepsis Day 2025. There'll also be the opportunity to ask any questions of our speakers. This will be after all the speakers. So for these, we ask you to please put your questions in the chat function. Bearing in mind, we are trying to keep things concise, so my apologies in advance if we don't get to everybody's question. But please do feel most welcome to follow up with the GSA after today's event if you'd like further information, resources, or the opportunity to talk to any of today's speakers. This is the first journalist-centric event that we have held, and we hope that it will equip you with some good data, stories, and practical tools to raise awareness and inspire global action against one of the world's deadliest, yet most overlooked health emergencies. I'm a journalist by trade myself, having worked in the UK for many years in both commercial radio and at the BBC, before moving to New Zealand in 2008. I've taught journalism at universities in the UK, New Zealand, and Australia, and worked as a regional correspondent for Radio New Zealand. Latterly, my career has been in communications and stakeholder engagement, and so I have a good understanding of what journalists need from an organisation such as the Global Sepsis Alliance. I'll be working closely with the GSA team to ensure that we're able to meet your needs and reporting requirements. We understand the meaning of a deadline and the pressure of working to one. We understand you need accurate and relevant information supplied to you in a timely manner, and we understand your need for multiple credible sources for your story. We also understand and respect your need to remain impartial, and that you will often have to present another side to any story we may wish to tell. My reason for becoming involved in the New Zealand Sepsis Trust and now the Global Sepsis Alliance is that my son had sepsis last year. It was a very frightening and traumatic experience, but I'm acutely aware that we were one of the lucky ones. Our son survived, but I'm acutely aware we so nearly had a different outcome. Our family's experience with sepsis taught me that surviving sepsis requires early diagnosis and treatment, and that awareness amongst both the general public and the medical community is vital. At the Global Sepsis Alliance, we're fortunate to have a huge breadth of experience and skills from around the world. Many of our board members are world leaders in sepsis research and treatment, and so we are able to offer you quite literally international recognised experts in the field of sepsis for you to interview in any media coverage. But what we also offer are the opportunity to speak to people with real experience of sepsis, people who've lost loved ones, and also survivors. Both have truly compelling stories to tell, harrowing, devastating, and tragic. Yet sadly, we know that these are the stories that make people stop and listen. It's the human interest and the real person approach that we know helps people to understand the devastation of any illness and why knowledge and awareness of it is critical. Because I have a strong background in journalism, I understand what journalists need from an organisation in order to ensure they get the best possible story. We will work with you to help you access the right people to speak with for your stories and ensure the content or resources we seek out for you are relevant for your audience. We understand that any medical condition is usually wrapped up with hugely complicated terminology, and it's often very difficult to break it down for a non-medical audience to understand. At the GSA, we're actively working to focus on less science and ways to help you extrapolate the information in a way that is manageable and understandable to a general public audience. You will find our 5 facts document, for example, hugely helpful in this regard. I've done a lot of work in this throughout my own position at the New Zealand Sepsis Trust. We have pared our communication right back and focused on simple, concise language. Things like any infection, anyone, anytime can lead to sepsis. And our current campaign strapline, suspect it, say it, stop it. We understand we need to make sepsis easier for people to understand, and we're committed to doing this at the GSA to support your reporting. Of course, we all know that every relationship between an organisation and a journalist is symbiotic. It's a two-way street, right? And one thing we respectfully ask of you is to consider partnering with us on regular reporting of sepsis. Often sepsis cases, so often tragic, hit the headlines for a day or two and then fade away. One thing we need to really affect change at a political level is regular reporting. If we could perhaps work with you on a series on sepsis, for example, it would allow us to keep up the momentum we so desperately need to save lives. To close my part of today, I would like to finish with some food for thought. 1 in 5 people around the world die as a result of sepsis. So if you relate that to media coverage and how every journalist always considers how relevant a story may be to their audience, then surely 1 in 5 health stories should be on sepsis. I shall now hand over to the president of the Global Sepsis Alliance, Professor Niranjan Tex-Kissoon. Tex is one of the world's most renowned experts on paediatric sepsis and is a professor at British Columbia Children's Hospital and the University of British Columbia. He is also the past president of the World Federation of Paediatric Intensive and Critical Care Societies. Over to you, Tex. Thank you.
Thank you very much, Ali. And it is my great pleasure, and I thank you for the opportunity to speak today to our journalist colleagues worldwide. I bring you greetings from Vancouver, where it's early morning, but I guess good night, good evening, wherever you are. Today, I want to highlight the crucial role of journalists and the media in supporting the Global Sepsis Alliance and its mission to reduce the global burden of sepsis in alignment with our 2030 Agenda for Sustainable Development and also the 2017 resolution of the United Nations and WHO resolution on sepsis. A short history of the Global Sepsis Alliance. It was established in 2010 in response to a glaring lack of awareness and action around sepsis globally. As you have heard, sepsis is a condition that affects contributes to 1 in 5 deaths globally and affects approximately 50 million people per year, including children, newborns, mothers, etc. Yet sepsis largely remains under-recognized in both policy and public health agenda. The Global Sepsis Alliance brought together clinicians, scientists, patients, and advocacy groups from around the world, unified by one vision, a world free of sepsis. And one of the most impactful initiatives was the creation of World Sepsis Day, observed every September the 13th, to raise global awareness and demand action of governments and health systems. Where do journalists come into the GSA mission? Journalists come in everywhere. Sepsis is not only a medical issue, it's a societal issue, and no entity is better equipped to educate, inform, and inspire action than the press. Here are several ways in which the journalists can help us. One of the major issues is raising awareness. The biggest challenge with sepsis is that most people, even in high-income countries, do not know what it is until it affects someone or someone close to them or someone they love. Journalists can change that. By covering personal stories, health features, and investigative reports, you can put sepsis on the radar of millions, helping people recognize the symptoms and seek early treatment, which can mean the difference between life and death. Journalists can also help us by holding systems accountable. The GSA advocates for better sepsis training for healthcare workers, stronger infection prevention strategies, access to clean water, hygiene, and vaccine, all of which intersects with global health equity. Journalists can spotlight gaps in healthcare systems, disparities in access, and neglected communities. And in doing so, you push policymakers and institutions towards meaningful reforms. In addition, journalists can drive global and local action. Journalists are key messengers in the global to local community communications pipeline. By translating international goals into local relevance, whether through stories in rural newspapers or digital platforms, you help bridge a gap between global resolutions and community-level understanding and action. Journalists are not just storytellers. You are advocates, educators, and watchdogs. Your work can spark public dialogue, influence policy, and ultimately save lives. So as we move towards the 2030 and we try to achieve the goals of the 2030 agenda, let us remember that the pen, the camera, and the microphone, these are not just tools of the trade. In the fight against sepsis, they are the tools of survival. I would like to thank you very much, and I look forward to a very fruitful and long participation with us in this fight together. None of us is immune from sepsis, and always remember that a world free of sepsis would certainly be a better world. Thank you very much. Ali, it's over to you.
Thank you very much, Tex. Now, the founding father of the Global Sepsis Alliance, Professor Konrad Reinhardt, is going to say a few words. As well as being founding president of the GSA and one of the key initiators of World Sepsis Day, Konrad is the current president of Sepsis Stiftung. Widely considered to be an international champion of sepsis, his research activities have led to more than 750 peer-reviewed publications. Over to you now, Konrad. Thank you.
Thank you very much, and I can only reiterate what has been said in terms of the burden and also in terms that sepsis is the #1 cause of preventable deaths, and it's not only about deaths, it's also about long-term sequelae for the survivors. And it's crucial that we address, with the support of journalists, not only the public, and educate the public, because about 20% of the causes of deaths are also related to poor knowledge of the public, both on the ways of sepsis prevention in terms of infection prevention. And there are huge differences in vaccination rates around the globe. And there are also, even among high-income countries, huge differences in sepsis outcome and sequelae. And there are so many things that matter. One is education of the public in prevention, as I said, in the understanding that sepsis has to be handled and managed as an emergency, which requires, of course, that also lay people know the early signs of sepsis and seek help. And likewise, it was said that there's a whole chain of survival which needs to be addressed. And it's fully known that 80% of sepsis cases occur in the communities. Often media take up sepsis only as result of superbugs and outbreaks in the hospitals, which are also, of course, important and need to be addressed. So often, and this is data from Germany, most recent data from Germany, where we have given on the resources that we have a far too high mortality rate. This is not only related to poor public knowledge, but also that healthcare workers, even emergency physicians, are not aware that able to timely recognize sepsis and etc. So the role of media is also important to report about sepsis, because I hear again and again by high-level policymakers that because they need to be re-elected, they select their topics on the awareness and the knowledge of people, and their media also can help a lot. With this, I will stop and feel very lucky that now we address this topic globally, and we can learn so much from each other, because, as I said, there are countries where mortality rate is half as high, despite the fact that their resources are the same. Thank you so much.
Thank you so much, Conrad, for your thoughts. As I mentioned earlier, we know that the real stories behind sepsis are the ones that capture the attention of the media and the general public. So it's important that we allow these powerful stories to be told. I'd now like to introduce Duncan Brown, who is the co-chair of the GSA's Global Sepsis Survivor and Families Committee. He is the father of Kwan Brown, who tragically passed away from undiagnosed sepsis in 2022 at the age of just 18. Since then, Duncan has advocated tirelessly for better awareness of sepsis in Australia and around the world. Over to you, Duncan.
Thanks very much, Ellie. Yeah, good morning and good afternoon and evening to some of you. Yeah, my name's Duncan, and look, I'm here today not just as the co-chair of the Family and Survivors Committee, but also, you know, as a father who's lost a son, as a father who discovered that his son's death was not unique, you know, it wasn't rare, and it was not unavoidable. Our committee is made up of people like me. Alongside me are the voices of millions of families worldwide who share a common thread. We've all been touched by this silent killer that claims more lives than heart attacks, strokes, or cancer. You know, we are fathers and mothers who held our dying children, you know, spouses who watch their partners fight for every breath, and survivors who now live with amputations, cognitive changes, post-sepsis syndrome. But what breaks our hearts every single day is that we are fighting this battle largely alone, and the isolation is suffocating. We are connected, you know, by this invisible thread of grief and determination, by survival, by a desperate need to prevent others from walking our path. But at the same time, we feel very disconnected, you know, due to limited resources for meaningful collaboration, but from the very institutions that should be our allies. We are prepared to confront our pain, and we offer our lived experiences to policymakers who nod politely, and then they return to their priorities. You know, we submit proposals that disappear into bureaucratic black hole. You know, and we have governments that are mobilizing millions, yet sepsis awareness campaigns struggle to get any basic recognition. You know, in the time that I'm speaking to you today, now around 60 people will lose their lives to sepsis. That's 60 families who will begin their journey many of us are on, learning to breathe, you know, in a world that feels impossible without their loved one. Yet how many headlines have been written about sepsis this year? How many government press conferences have been covered on sepsis preparedness? My son, Kieran died because of ignorance. Simple, preventable, fixable ignorance. And we don't need pity. That's not helpful. We need meaningful partnerships. We continue to hear about preventable deaths because governments somehow still believe that sepsis is somebody else's problem. It's everyone's emergency. This is not just a medical crisis. It's a crisis of priorities, of awareness, and of a political will to make sepsis a priority. So to all the journalists or anybody that is involved in media, you have something we don't have. You have a voice that governments and the public hear. And you have the power to change the narrative. Now, every story you don't tell about sepsis is a story that could save a life. Every government health briefing you attend where sepsis is not mentioned is an opportunity to ask why. Our committee members are ready to share their stories. Their stories are raw, they are real, and their stories are transformative. They can move policy and save lives. We are ready to connect with you and to provide that human face behind the numbers. The question is, not whether you will encounter sepsis in your reporting. It's whether you'll be ready to tell the story that saves the next life. Help us turn our pain and our loss into protection and life-saving action. Help us ensure that no other person has to learn the word sepsis the way many of us had to. And please help us make sure that no other parents have to join our committee. Thank you. Thanks very much, Ali.
Thank you so much, Duncan, and we really appreciate you and so many other families who are willing to share your stories. That's very generous of you. Thank you. We're now going to play a short video address from Yusuf Kadami from Germany, a father of a 2-year-old son with quadruple amputation as a result of meningococcal sepsis. Tragically, he, like so many people, had never heard of sepsis before his son was sick. So Simone is going to play the video for us now.
I joined it.
I don't think we're getting the sound there.
The entire year of 2024. During this difficult...
Apologies, you might have not received the sound right so far, so let me play it again.
Thank you.
Hello, everybody. My name is Yusuf Kadami. I am 35 years old. I'm living in Germany, near Frankfurt. At the beginning of January 2024, my 2-year-old son fell ill with meningococcal sepsis. As a result, he lost both of his lower legs and all of his fingers. Altogether, we spent 9 months in the hospital, almost the entire year of 2024. During this difficult time, and even now, I keep asking myself, why had I never heard of sepsis before my son gets sick? Why didn't I know that any infection can lead to a sepsis? Didn't I know that especially young children and people over 16 are high-risk groups? At the first, we thought it was only us who didn't know. But then we realized that even friends, family, and some medical staff we were unaware of how serious and common this can be. That's when I understood this is a societal problem, a big societal problem. How can it be that most people know about heart attacks or strokes, but hardly anyone knows about sepsis? The reason is simple. People are not being educated about it, not in schools, not in the doctor office, and not through the media. Journalists should report on it much more often because people forget things so quickly. Many don't even remember what they eat the day before. That's just human nature. And that's why topics like sepsis need to repeat it again and again until they are truly onshore in people's minds. As a father directly affected, I ask you, please report more often about sepsis, like cancer or other ticks, the same. I myself have decided to raise awareness. This year, I wrote our story down in a book, which will probably be published at the end of this year, first in German. Later, I would like to have it translated into English in order to share my son's story internationally. If anyone could help us with this, we would be very grateful. We would even be willing to have our story made into a film to help reduce the number of deaths from sepsis. My wife and I love watching movies, and we noticed that there are hardly any films about sepsis, while other diseases are covered much more often. The film industry also needs to address this topic because it reaches a huge audience. I truly hope that together we can raise awareness and educate as many people as possible about sepsis. Thank you for your attention and bye-bye.
Thank you to Yusuf for that video address. Our next speaker, Mariah, has just been held up, so we're just going to move along. Just before I introduce Jackie, I just want to remind everyone, if you have any questions, do please feel free to put them in the chat, and we will address them after Jackie has spoken to us. So our next speaker, as I've mentioned in our Human Voices section, is Jacqueline Duda. As well as being a working journalist, Jackie is a septic shock survivor and a vocal sepsis and disability advocate. But I'll hand over to her to tell you more.
Thank you so much, Ali, for that. And thank you, Miriam, for having me here today. And, I'm so glad I made that comment on LinkedIn this week that brought me here. I am very excited about the Global Sepsis Alliance and your push for more journalists to cover this topic. I am a septic shock survivor, as Ali mentioned. 4 years ago, I had a colon perforation from undiagnosed diverticulitis. I'd never heard of sepsis before, and neither did my family. And nowadays, it's all we talk about in my house every day, sepsis. I had to be flown to a hospital here in Maryland and Baltimore to save my life. I didn't have an hour 20 left to live, according to the doctor in the emergency room. Therefore, I called my recently launched podcast that I launched on my Life Day this May on YouTube. I call it the 120 in, sort of recognition of that pinnacle time in my life in the emergency room that morning. As a journalist, I have written about a half a dozen articles so far on sepsis. I've written my story. I've written about sepsis and the challenges of getting recognition and making people aware. My stories have appeared in the Washington Post, Reader's Digest, and the Lancet recently, where I wrote about post-sepsis syndrome, another very unrecognized disorder that a lot of us survivors are trying to get the medical community to research more about and understand. And as far as World Sepsis Day next Saturday, which is also my birthday, ironically, I will be here in my hometown in Frederick, Maryland, hosting a booth at a very popular street festival called In the Streets. It receives about 70,000 visitors every year, and I will host a booth to help raise funds for Sepsis Alliance, where I'm an advisory board member now, and also to educate people about sepsis. We're going to have a little game called a Sepsis Jeopardy game and have people stop by the booth, answer questions, and see how much they know about sepsis and infection prevention and control. As far as like getting, as a journalist, I mentioned this yesterday on the call, that the biggest challenge is getting our editors to greenlight these articles. I have probably proposed 50 or more sepsis articles in my time since becoming a sepsis survivor, because it's now my personal mission. I'm going to get as many articles out there as I can. And often I hear from editors, well, we covered sepsis 5 years ago in a short 10 bullet point list of signs to look for if you have sepsis, but not those personal stories. Those are the stories that grab our attention. Those are the stories like Duncan's. And, you know, Duncan, I'm so sorry for the loss of your son. And those stories grab our attention. Those stories make people feel. It puts a face to this syndrome that people have a very difficult time understanding. So as a journalist, what I've noticed is my personal challenge is convincing editorial staff and the publishers to run these articles, to approve these articles as often as they do the articles on cancer and heart disease, which we see all throughout the media, and that's a good thing. You know, I'm not disapproving of that. That's a very good thing. We're all aware of cancer and heart disease. But as many of you have already said, we also need people to be just as familiar with sepsis, and that's only going to happen through more media coverage. And as the previous father had mentioned, there are no like films on sepsis or anything. There are more. It is coming up more, though, in TV shows. And here in the States, there's a show called The Pit. It's called The Pit. It's filmed in Pittsburgh, Pennsylvania, and it's a TV show about an emergency room. And one of the first things they're repeatedly saying when patients come in is run a sepsis protocol. Do we need a sepsis protocol? I watched the first season, and they have mentioned sepsis at least maybe a dozen times or so. It's a little bit of progress, and I'll take it. So thank you again for having me here today. I really appreciate all of you, and I appreciate all the hard work all of you are doing. I'm so happy to be here. Thank you.
Thank you very much, Jackie. So we'll come to the questions in a few moments, but for now, I would just like to reintroduce the Honourable Dr. Mariam Jashi, the CEO of the Global Sepsis Alliance. She's the former chair of the Parliamentary Committee and Deputy Minister of Health in Georgia, and has spent more than 27 years working in global health. She is the co-author of the 2030 Global Agenda for Sepsis and has made it her personal mission to elevate sepsis in the global political health agenda. Thank you, Mariam.
Thank you, Ellie, for the introduction. And I cannot thank everyone for joining us today. All your stories are really life-changing, and we have to make sure that your voice reaches the global audiences, and not only the hearts, but minds and the daily decision-making processes, both in our countries and at international levels. I'm mindful of the limited time we have, so I will try to really very briefly walk you through the 5 facts and 5 actions policy and media brief that the Global Sepsis Alliance we put together for this year's campaign, and try to simplify some of the messages and the ready-on messages for media presentations or pitches. First of all, we have to remember that sepsis is the leading cause of deaths globally. And we already heard that every 3 seconds, someone dies from sepsis. And with proper communication and media coverage, can you imagine the number of lives we can save from sepsis. It affects almost 50 million children, women, and men every year, and responsible for every 5th death. Exactly. Every 5th media coverage should be speaking about sepsis, because all those lives are, all those deaths are preventable, and we can save at least 11 million lives from sepsis every year. And this is the human face. Brian Hayes, father of Robin Hayes, our dear colleague and friend from South Africa. Second fact is that globally, sepsis hits the most vulnerable the hardest, irrespective of the countries. Yes, 85% of sepsis burden is in low and middle income countries, but even in high income countries like United States, at least 350,000 deaths happen due to sepsis. And young children, women, elderly, and immunocompromised are affected the most. And we have the second human face, our dear Halima Saliku Karbara from Nigeria, who is the mother to the sepsis survivor. And she has been one of the experts and global board members of the GSA. Number 3, most deaths from sepsis are preventable. Every vaccine matters because every infection that can be prevented by vaccination can lead potentially to sepsis. So vaccines, water and sanitation, and infection control measures are vital, but early detection of sepsis is life-saving, because every hour of delay of detecting sepsis and starting administration of life-saving antibiotics increases risks of death from 0.4 to 7%. And administration of sepsis bundles, with an example from our dear friends in UK Sepsis Trust, is truly life-saving. Number 4, only 15 out of 194 WHO member states, countries, invest in sepsis. On one hand, we have a cause of 20% of global deaths, and we have only 5 countries who are prioritizing sepsis. This is a paradox. Less than 10% of countries have sepsis bundles and protocols, and at the same time, we know that sepsis is a great investment case. So those are the list of countries that do prioritize sepsis. But again, the second paradox, sepsis is the most, the poorest countries, and we see the action, policies, and evidence generation from the richest countries. When we speak about antimicrobial resistance, it's amazing that AMR has really reached the highest possible policy discussions, and their advocacy efforts are extremely successful. But let us also remember that human face of AMR is sepsis. And when we speak based on the latest data from Oxford University and IHME, that in 2021, 21 million lives were lost to sepsis as immediate or intermediate cause. This number included 4.71 million associated or attributable deaths to AMR. The final fact is that stronger sepsis response is essential for global health. We cannot achieve sustainable development goals without addressing sepsis, and sepsis is a powerful indicator of how health systems work, starting from primary care to emergency, ICU, and post-sepsis care. And let me quote Dr. Jeremy Ferrar, the Assistant Director General of WHO, that sepsis is the microcosm of health systems. In terms of actions, first, every country should prioritize and fund sepsis response, and we have to reach the ministers of health and parliamentary committees to develop and finance national sepsis plans. And we have the example from our friends and Sepsis Rory Staunton Foundation, who are advocating for adoption of sepsis bill at the US Senate. But sepsis should be part of the integrated approach to health reforms and universal health coverage. Every country should develop sepsis protocols and train healthcare providers. And another excellent example from the United States, Sepsis Alliance Institute, that has already reached more than 55,000 healthcare workers through targeted evidence-based guidance and training. Every level of healthcare providers should be trained, and sepsis should be part of medical and nursing curriculum. The third action we call for is that global health sector should prioritize sepsis and fund sepsis response. Sepsis is the best investment case in global health, which UN should call for global investments in sepsis science and knowledge, and we have to create funding possibilities from donor governments, grants and loans of World Bank, Gavi, or other financial institutions, as well as philanthropic foundations and research programs. And of course, we need investments in new vaccines, diagnostics, and treatment for sepsis. The primary focus of our today's webinar, media can save millions of lives from sepsis. And this is an example from one of the famous German newspapers, covering the visit of Bill Pullman, the famous US actor and filmmaker, who is filming the documentary on AMR and sepsis. Sepsis kills more people than heart attacks and stroke, and yet we don't have the proper awareness. Media can be a game changer. We have to make sepsis a household term and the term that will be associated with immediate emergency care-seeking behavior. Media can hold governments accountable and ensure more regular reporting on sepsis. Finally, every future pandemic similar to COVID-19 will increase sepsis risks and deaths due to sepsis. 78% of COVID patients in ICU had sepsis, and we never heard about it. And every emergency increases sepsis risks, armed conflicts, humanitarian crisis, or other emergencies. So we have to integrate sepsis in those relevant plans. And concluding with the words of Dr. Tedros, WHO Director General, that nobody should die from sepsis. Thank you.
Thank you very much, Mariam. We've got Mariah's with us with now, so I'll just introduce her. Our next speaker had a hugely successful stage career cut short, sadly, as a result of sepsis. Multiple sepsis episodes, over 60 surgeries, 2 transplants, and a coma changed Mariah McKimbra's life, and she now works tirelessly to raise awareness of sepsis on a different stage, that as Executive Director of Sepsis Stiftung in Germany. Over to you, Mariah.
Thank you very much. Hello, everybody. It's an honor for me and a pleasure, and I'm so sad that we need to meet up and talk about sepsis after all these years. And last year, I started with that journey to give something back. And so it's now exactly a year, and I'm really sad that to see, as a person who lives through it, that there is nothing much changed in Germany at all. And seeing all the other people around me, and every time the story is the same. It's always that nobody listened. I asked, but nothing happened. And I know we can do better than that. And to realize that it's almost always the same stories highlights that there is a problem in the systems. I have a wish. My wish is that we really make it happen, not only in Germany, but all over the world, to join all our energies and to make it in everybody's heart, so nobody else have to pay with their heart and with their loved ones. That's my wish. Today, I'm not here as the executive director or the former the former stage performer. I'm really sitting here as somebody who lived through it. And today I had a little talk with my doctors because I'm going to have another surgery in December. And I had a rush of panic coming up because I realized I pushed it all away. And with all I know today, I'm so frightened to go again to a hospital and, you know, give my life in those hands again. So today I'm a little bit excited. I think I cannot push that away. But so that's my wish. I really wish with all my heart that everybody here, if you only talk with one, if you only talk with two, and not only to ask, but to really to energize people. Everyone counts. Every part of us is important. And I know and I believe together we can make it. This is the biggest story of health. We are living history in this moment. And everybody here can change it. So sorry for my up heart today, but it was a very emotional day for me. So that's how I feel today. So now you feel it too. And I thank you very much.
Thank you so much. And thank you for your honesty and for sharing your day with us. We appreciate that so much. We've got some time now to look at some of the questions that are coming in on the chat. And thank you so much to everybody for getting involved. And I hope you found it useful so far. A couple of questions. I can see that Jackie's very kindly chipped in with some answers there. So that's really helpful. So do keep an eye on the chat as well, because some of the answers will be given to you there. But I want to address Salome's question. Considering the global variability in healthcare infrastructure, what scalable innovations in sepsis management have shown the most promise in bridging the gap between high income and low income settings? I was thinking, Mariam and possibly Tex, either of you might like to answer that one. I'll start with you, Mariam, though. Thank you.
Thank you, Ellie. I think when we speak about the reducing inequality, Tex is definitely the person who has worked a lot, both in low and middle income countries and high income countries, and I look forward to his addition. So what we know that innovations is one part. Of course, we need innovations, we need more investments, but awareness raising and training of healthcare workers, even without bringing in any new vaccines or any new diagnostics, is already a major success step. For example, Australia reduced the in-hospital sepsis mortality by 50%, by half, only by training frontline nurses and the medical professionals on the possibility of sepsis. So could it be sepsis is the magic question when any patient enters the emergency room. Let me stop here, Ellie, and hand over to Tex.
Thank you.
Thanks very much, Ali and Mariam. I think that this is a very important question. And I think when we look at sepsis, I always say that there are many faces of sepsis. It's a problem that is a societal problem. And if we look at low and middle income countries or poor areas in the world, there are many things that we can do to prevent sepsis. I think that's important. And for example, things like clean water, better nutrition, right, sanitation, hygiene, etc. And I think, and vaccination, because with poorly resilient health systems, which does not have many resources, we need to prevent the number of patients who develop sepsis. Now, when they come to these institutions in poor areas also, it is shown that what we need to do is deliver what we know that works. And again, it comes with training the healthcare staff. In fact, an editorial a few years ago in The Lancet said what we need to do for sepsis, for the poorest of the poor, is the science of delivery. So assessment of these patients quickly, given simple treatments, for instance, oxygen, fluids, antibiotics, or antimicrobial therapy, and monitoring them is very important. And I think if we do those things up front, we are going to save many lives. The other issue is the education of the public. And I think this is where this is very important, because studies have shown that if a mother has a high school education, her under 5 children has a 31% less chance of dying. And if a father has that education, the children has a 17% less chance of dying. And studies have shown across South Asia, Sub-Saharan Africa, Latin America, that education of patients and families are important, such that they do not arrive late for treatment. Of course, there are the logistics of poverty. And in fact, years ago, Margaret Chan, who was then the director of the WHO, when she was asked about the issue, why the outcomes of Ebola, which is sepsis, were so different in Africa, right, high mortality as compared to the rest of the world, she said, I can explain it to you in one word, poverty. So we have to think of sepsis as not only an infection, but we have to think of it that many things impinges on what happens in sepsis, and it is really poverty. It is really government priorities. For instance, during the COVID epidemic, which was a pandemic, which is sepsis again, the vaccine distribution in the world was very inequitable. For instance, Canada had about, at the height of the pandemic, 85% of individuals partially or fully vaccinated, whereas in sub-Saharan Africa, it was about 10% or less. So I think there are a lot of things that we have to think about. And as Paul Farmer said, borders are like semi-permeable membranes where infections and sepsis pass freely, but at the border stops finances, cures, drugs, etc. So we have to break down those barriers, and with sepsis, think globally. Thank you.
Thank you. Thank you, Tex. Conrad, I think I saw your hand up. Did you have something you'd like to add?
Just to give you some numbers on the issues, how much sepsis is preventable. At 1900, the crude death mortality rate in the United States of America was 800 per 100,000 population. This decreased to 36 per 100,000 population until 1986. From then on, it increased again. I don't want to discuss the reasons for that, but this decrease was due really to public health measures already mentioned, including chlorination of water, sanitation, setup of health departments, which is not the case still yet in most parts of the world, especially in sub-Saharan Africa. And there, just to clarify, that according to the new Global Burden of Disease report, in Africa, there are countries where 70% of all deaths are attributable to sepsis. At least this was the case during COVID-19, and it's all about prioritization of and resources, and this is this overall inequity which has to be overcome, but also, and this is also threatening, that in high-income countries, there are countries like Australia where we have only 110 deaths per 100,000 population, whereas we have in the US and in Germany and in UK more than 250 per 100,000 population. So there's so much room for improvement everywhere. I stop here.
Thank you very much, Conrad. going to try to address another quick question if we can. The question from, I'm going to address this to you, Mariam, again, if that's okay. Why do rich people and governments invest in, I'll explain what that is just in case people aren't aware, the Global Alliance for Vaccines and Immunization, which is now called the Vaccine Alliance. So why do rich people and governments invest in that, but not in sepsis prevention, do you think, Mariam?
Thank you, Ellie, and thank you, Lenson, for this excellent question. Indeed, what we're trying to do as the Global Sepsis Alliance to elevate sepsis at the same high-level political platform where UN member states as governments will be prioritizing sepsis. Only after United Nations prioritized immunization or HIV/AIDS, the Gavi and Global Fund were created. And plus, both of those foundations had a very important seed funding from the Gates Foundation that actually played a catalytic role for mobilizing the donor countries' contributions. Today, the pledges from the governments to both Gavi, Global Fund, and UNITAID are substantial despite the recent global health crisis. And we really hope that we will open discussion with both foundations to make sepsis at least part of their health system strengthening grant portfolios.
Thank you, Mariam. Another, just probably the last one we have time for, from Salome. Does the Global Sepsis Alliance or its partners currently have a coordinated communication strategy that ensures accessible, ongoing collaboration with media outlets worldwide? Are there planned or upcoming campaigns specifically designed to provide journalists with sustained opportunities, resources, and platforms to elevate sepsis awareness effectively across diverse regions? I'll very briefly touch on that yes, absolutely, we are really working very hard on that, and that's what today is all about. Actually, it's the sort of the start of really stepping up the efforts to do this. We understand that it's so important that we have a plan and we have a mechanism to communicate with our reporting partners, and many of our organizations around the world are doing that right now as well independently, and we're sort of coming together with the GSA. But Mariam, did you want to add anything to that as well just before we move on to Simone?
I think that Simone will answer a lot of those questions in his kind of intervention. And I just wanted to acknowledge the Disha Gujarati's comment also on the medical students that was already answered, and we hope to keep in touch on that very important aspect of medical students mobilization.
Well, great opportunity to introduce Simone now. Simone Mancini, the Partnership Lead and Coordinator of the GSA's Regional Sepsis Alliance. So I'm going to give you about a minute and a half now to chat to us.
Perfect. Thanks, Ellie, and thanks everyone. It's a pleasure to wrap up this very, very interesting session. And so in my 1 minute, I want indeed to share actually what the tools actually that are already available for everyone, but of course also for journalists to support your work in covering sepsis. Of course, we do plan, as Ellie and Mariam said, we do plan to have a more structured and regular and strategic approach to media. This is really the beginning. We want to build relationship with you, with journalists, and we hope that it's really just the beginning. Meanwhile, I think I'm going to really quickly share what the resources that are available on our website. First of all, we heard today a lot of very touching, strong, and witnesses, and we have a section on our World Sepsis Day website about stories, and there is a lot of variety. As you can see, lots of young people, but not only, that have been affected by sepsis. So all the stories are there, and please feel free to refer to those, and get in touch with us if you want to follow up with some of those contacts. We are also, in view of World Sepsis Day, which is going to take place on September 13, like every year. There's, of course, as every year, there's a page with all the tools that are available there. And we're talking here, of course, of the briefing that Mariam presented earlier. But of course, there's a whole huge set of infographics and visual supports that are really copyright free and free to use. These will be updated regularly, but please feel free to use those you find online. There's a whole toolkit section with slides and a lot of material that you can browse through. There's also like a photo board that you can use, board that you can print to show your support for sepsis, for the fight against sepsis during your events around World Sepsis Day. And a little commercial break, we also have a shop, an online shop for some merchandise. And if you're still organizing events, or if you're interested, you are still in time to buy your favorite goods before World Sepsis Day. Of course, we have a YouTube channel with with all our events, webinars are available there. It's a World Sepsis Day channel, and of course on the page of today's webinar, at the bottom, you can find all these tools, easy to reach there. So this is a very brief overview of the tools that are available, but of course we are always available, and you're really wishing to establish contacts. We are available for any further inquiry.
Thank you, Simone. And just as we close, I just want to say thank you so much to everyone for joining us today and for your willingness to learn more about sepsis. I hope it's given you a better understanding of the condition and also has offered an insight into how we might be able to support you with any media coverage going forward. We sincerely thank you for your time and your interest, and we hope you'll join us in helping to unmask sepsis from being a largely invisible global health emergency to the top of the international political health agenda. Thank you so much for your time.